So in terms of the bigger picture, our evidence to practice work is the work that we've been doing for 50 years around technical assistance. And a lot of people often think, oh, you guys do TA. And in fact, for the last 50 years, we have been bringing evidence to practice. Our focus in our TA is ensuring that we're bringing both evidence and data to our technical assistants. And on this slide, you can see that there are sort of 5 key approaches that center our work. And I'm not going to read them all, but I just want to bring your attention to a couple of key important things that I think is important about how we approach the work that we do. First, we sit side by side with our partners in this work, and we tailor our work to what their needs are. So we always begin our work by listening first, so that we're ready to respond to their needs. And rather than doing two, we work with organizations and nonprofits and government institutions and philanthropies as well. And then, of course, being also a research shop, we think it's very important to bring both data and evidence to our work. Liz is going to drop in the chat some more details. So if you're excited about learning more about our evidence to practice technical assistance, you can see it there. So we work with organizations and government entities and philanthropies, as I mentioned, in 4 different ways. We have 4 different approaches to our work. The first, in the next slide, you'll see, there are 4 different ways. The first is that we work with organizations to help them better use their data. We work with them to take an evidence-backed program and either adapt it or launch a new program, or if there's something they want to scale, we work with organizations to do that. We support readiness towards an impact evaluation and just strategies for learning ways of making a real difference. And then today, the focus of the work is going to be on our 4th area of work, which is diagnosing and addressing challenges. So now I want to introduce our speaker, which is the main event. Very excited. So Rebecca Schwartz will be presenting today. She's led partnerships to help anti-poverty programs work better for clients and staff. And since 2018, she's been working with MDRC's Applied Behavioral Science program. And she's collaborated with dozens of government partners and nonprofits, helping them to improve how people access and navigate programs. Before joining MDRC, Rebecca worked to implement both education and health programs, both in New York City and in rural Guatemala as well. So she's got some international experience. Anyway, we're thrilled she joined us, and you're in for an amazing hour. She holds a master's in public policy from the Harvard Kennedy School of Government, and I am going to pass it to her and myself listen and enjoy learning, as I always do whenever she speaks. So Rebecca, take it away.
Well, thank you so much, Sam. I'll try to live up to that hype woman. But yes, for today, we will be covering 3 what are hopefully very practical applications of behavioral science. So the first one is about the way that choices are presented. The second is about strategies to take a human-centered approach in your work. And the third, the most fun, is how to actually design behaviorally informed solutions, especially using a checklist that you can take with you, and hopefully you'll be able to apply well beyond the life of this webinar. However, to start, we'd love to hear a little bit more about you. So please take 30 seconds to fill out this 3-question poll so we can get a sense of who is in the room. Are people able to see the poll?
Sorry about that. I just relaunched it.
Great. So I'm not seeing. Oh, okay. Good. We tried not to. The questions hopefully are not too hard. Okay, excellent. They're coming in.
Okay, we have a good amount of responses, so I'm going to close the poll in 10 seconds.
Okay, they're still coming in, so give it one more minute. All right, I think that's good. Okay, so I stopped and shared the results. So who was in the room? This is great, just what we hoped to have a range of different fields. And so hopefully the cool thing about behavioral science is it is about the behavior of humans, and we're all humans and we mostly work with humans, although I know robots are, on the rise, but hopefully everything will be relevant. And also these different fields that you're in is how you'll be divided in that peer session if you're able to stay. So you'll get to talk to people more in your field from across the country. And then for number 2, what kind of role do you play? We'll be talking about program strategies as well as communications. I do think for those 7 people who said you don't generally work on communications materials, that's probably true. I think we could expand the idea of communications to think about even interactions with coworkers and customers, whether that's students or parents or clients. And then lastly, I guess I'm the only one who's claiming they could lead this webinar, so I guess that's good, but glad to see we have most people who are somewhat familiar with behavioral science, so hopefully you will learn some new things and sharpen your knowledge. So thank you so much for participating. And we are going to keep going. So from the poll, as we said, we have a variety of fields represented, and that really lends itself well to MDRC's Center for Applied Behavioral Science, which we call CABS, which has a specific toolkit that can really be applied across any program. And as one arm of MDRC's evidence to practice work, we've been lucky enough to work with a majority of states across the country and many of types of anti-poverty support, from Head Start to workforce development to higher education. And with the randomized tests, we've also tested dozens of interventions, which is a key part of why we think that what we're going to talk about actually works. So the first bucket that we have is called choice architecture, about how the arrangement of choices affects our decision making. And a fun fact is that the book Nudge, which is a very famous behavioral science book, actually I heard the author, Richard Thaler, speak, and he had wanted one of the the sort of subheader to be choice architecture instead of just nudge. So it's a little factoid that you can take with you. So a lot of programs are designed assuming that people are rational and that sort of decision making goes in a straight line. So the key thing about behavioral science, which gets me really excited, is that behavioral strategies really work because they think about how people actually make choices. And so in general, we aren't kind of robotic, just getting information, doing a cost benefit analysis of every little decision, and then taking action based on our preferences, which is what standard economics would say. So instead, in behavioral science, we think about how we're subject to our environment and different human contexts. So for information, you need to see the right information at the right time, among other challenges, and that's especially hard in the age of the internet, and just generally information overload is a huge challenge in our society. So a lot of times it's too much content to sift through. And then when we get into decision making, we think a lot about what motivates people in behavioral science, especially the context of our past experiences or what we've heard from our friends. And then even if you do have the information and you make a decision and you have every intention of trying something new, you may then get that animation. Great. You may then, just have life happen, and then that prevents you from following through on an action. So that prevents you from following through. So you might get a call that your child needs to be picked up sick from school, and then all of a sudden the thing you were going to do kind of goes by the wayside. So when you see this chat image in the top left, that means that we're going to ask you to participate again in the chat. So please get ready for that with this quick question, which is, which of these arrangements of a classroom or a meeting or a session that's in person would make you more likely to participate, A or B? A, great. All right, seeing a lot of Bs, which is great. So this is a really simple example, but it actually, I'll share later, it actually relates to a real experiment that we did. And an exciting thing is that you could be able to apply something like this immediately because you're not actually buying more chairs or spending any money between A and B. You're just arranging the chairs that you have in a new configuration. So let's try one more. That's also not that hard, but a little different, which is a supermarket example. So which one of these would make you more likely to make guacamole if you're in a supermarket with a display like A or with a design like B? Okay, I see a lot of Bs coming in again. So I love this example because A, I like guacamole, and B, I really have seen this recently in my supermarket. And like the chairs, it's really the same raw materials, just set up in a different way. So with version A, you still could make guacamole, you would just have to put a lot more effort in. And when we think about real people who are often busy or stressed, they just need to get in and out of the grocery store. So hopefully you could see how guacamole might be related to your program, but to make it explicit, if your program goal is the equivalent of making guacamole, then are you making it as easy as possible for people to do that? And that's really what behavioral science has us think about. So I'm going to ask again, and one more question, which you don't have to put in the chat because it's kind of a trick question, but it's which grocery store has a neutral design. So just think about it for a minute, A or B or neither. Okay, and so the answer that I will give is that there actually is no neutral design. And if you are taking notes, and hopefully you are, I want you to write this part down because it's really important to remember that the way choices are arranged in your program right now is affecting the way you or your staff or your clients make choices. It just may or may not be intentional. So we know that behavior change is hard, and most people are more inclined toward the status quo, which often means just not engaging with something. So many program designs and communications might be nudging people away from engaging instead of towards engaging. So maybe example A is nudging you towards just buying more fresh produce, but maybe those vegetables are in the back of the store and it's actually nudging you towards buying the junk food that you see when you first walk in. So the last slide of this section, sorry, second to last, is that you are a choice architect. So again, when you thought about sort of your role in communications, all of us do make design decisions, both personally and professionally. And so you do have some degree of control over whether you're making things as easy as possible to do whatever your equivalent of making guacamole is. So remember, version A was not neutral. It was just less likely that you would make guacamole. You still could, but you'd have to go through more aisles and be more kind of determined that that's what you're going to make. Okay, this is the last slide of this section, choice architecture. And this figure is a continuum for how to get increasingly more people to take a behavior. So at the top, if something's mandated, basically everyone should take an action. And at the bottom, if something is prohibited, very few people should take that action or no one. The interesting idea for behavioral science is really the part in the middle. So in particular, you can think about whether a choice can be reimagined as a default. For example, when I've worked with employment programs, you could get more uptake if a staff member says, I think this program could be a good fit. Can I put your name down to, get a call or get some additional information from our partner versus just saying, do you want to opt in and participate in a voluntary program? So do you want to participate in a voluntary program is opt in, and a lot more people with something like SNAP employment and training that I worked a lot in are going to say no. But if you say you said you're looking for a job and we have some really great resources. Can I connect you with someone and they'll give you a call and then you can decide. You're kind of getting people to that next step. And then the middle option in this chart is called active choice, which just means that you have to decide yes or no. So one place we see that a lot might be the DMV, and it's about voter registration. So we're not going to tell you if you're going to register or not, but you do have to click yes or no. You have to make a choice in order to get to the next screen. So think about how your choices are arranged, and that can be a pretty powerful tool. Okay, so for topic 2 of 3, we call this participant centering. And a participant could be any user that you choose, yourself, your staff, customers, students, parents, etc., because we have a lot of fields represented. So thinking about your participants, behavioral diagnosis is a way that you can identify by behavioral barriers versus structural barriers. So what do I mean by behavioral versus structural? So take transportation as a common barrier that I hear in a lot of contexts. If a participant can't make a class or a meeting because there is no bus, then creating a bus route where there was none is a structural problem if there's no public infrastructure. That's still something that should be addressed. However, the behavioral element comes in when the participant knew a week ago that they had no viable means of transportation to get to the meeting, but no one anticipated that they might need to talk about that and make a plan, whether that means they have to go virtual or there's an Uber card they can get or some kind of carpool. So it's about sort of the planning with what you have that becomes behavioral. And so to help participants succeed, you have to understand behavioral barriers so you can strategically design solutions. So no is about, we're going to talk a lot about this and we're going to do a mini quiz via poll again. So please pay attention. So no is about information and specifically what information you might be missing. Is there too much or too little? And as I said, in today's world, there's often too much information. Motivation, the why. Why might you be hesitant to engage? Are you asking someone to try something new or potentially intimidating? What are their peers and family doing? What might they say or think? So there's a lot of factors that affect motivation. And then third is do. Even if you understand something might be good for you and you feel motivated, what life events might happen that make you forget or not show up to something. So now we're going to practice. Okay, so this is the mini quiz to get more comfortable with the know, feel, do framework. So let's think about a high school cafeteria. And if the goal of the school staff was, in my whole high school, it does not seem that it was, but if the goal was to get students to eat healthy, I'll do the first example. A barrier could be that some students are unaware of how many options the cafeteria has or the calorie counts on each option. So that would be a no barrier because that's information, being unaware of something. And now we're going to have you do the 4 remaining examples and quiz yourself and just do your best, no pressure.
I'm going to give the poll like 30 more seconds, so please make your final guesses.
And if you did finish early, this is, a moment to potentially use that Q&A if some questions are coming up. Okay, it looks like 1 or 2 more people are still coming in. It is fun to see the answers come in because I can't see most of you. I do want to comment while the last people are submitting that I do notice like one social norm that we talked about as being important is that some people, quite a few people are on video, which I really appreciate. And that's something that, becomes a social norm. If you see most people on video, you might want to be on video in a chat. That's the environment that we're trying to create. I maybe just saw someone go on video. I won't name names, but sort of seeing the social norm and then calling it out can be, a pretty powerful way to think about behavior change. Okay, so I think that the results pretty much stopped coming in. So I'm going to go through these. Okay, so for the first one, I would say that this is, as most of you said, a do barrier, because you had the motivation to eat healthy, but in the moment life happened and you weren't able to follow through. You made an impulse purchase, which is actually what they call like the candies they usually have at the checkout line, right, at a grocery store. So there's a lot of choice architecture and behavioral science that you'll probably notice at grocery stores in particular if you haven't already. Okay, number 2, some students grab a salad but then see all their friends eating pizza. So again, that's going to be feel very good. And that's basically, as I was indicating, behavioral science has consistently shown we are very subject to what our peers think, even way after high school. So peer pressure and caring what other people think or what we think is socially acceptable or cool doesn't really ever go away for most of us. Maybe you're the exception, but I can solidly admit that I am not, and I do care what people think. Number 3, this is pretty tricky. And we can see that with more of a split, although the majority of you put the same thing that I put, which is feel, because if people had even one bad experience, even if it's in a different context, so this is the salad that your parents make, not the salad that your school makes. It could be totally different, but it does affect your willingness to do something. It can put a bad taste in your mouth, and those can be really salient and stick with you. So with a lot of populations that we work with, if someone has had bad experiences before with, say, school or employers, even if a new opportunity could be much better, it can be really hard to overcome a prior bad experience. So it's just a barrier that we're up against that we have to be aware of. And then for the 4th one, as most of you put, I also would call that a no barrier. It's not clear who to ask when the fruit runs out. Great. Okay, so these are our final slides in this participant centering part. So this is just, hopefully you're getting ideas about how this could apply to your work. This is a high level overview. So since this section is called participant centering, you should start by picking a key user to focus on. Then from their perspective, you start with a simple process map. So in this case, we picked the participant in, let's just say this is a workforce program, but it could be an education program. That participant could be a student or a parent. So they receive some information, they attend a first meeting. You could get more granular. You could say maybe they have to sign up for an info session after they receive the information, and then they attend the first meeting, then maybe they attend the second meeting, then all sessions, and then ultimately probably all of you are in programs where you want people to have a better life. And so a key part here is that in order to narrow down where you want to start, it's good to try to attach numbers to as many of these steps as you can. And then we'll give an example in a few minutes. And so at this case, we're focusing on what we call the front door problem. So that would be sort of getting people initially in a program. That's one big area of engagement I often work on. Another area is once people are in the front door, are they continuing to come back? Are you retaining, and are they ultimately completing whatever the course or service is, or successfully getting a benefit? So once you have these key ideas of, what is your focus area, what's your goal, and what are your steps, then you can start drilling into the barriers. So this is a small plug for our 2 p.m. peer session, where you can really think further about how these apply to your specific context and talk about it with your peers. Okay, so for our final section of the webinar, we have the most exciting part, which is how to go beyond understanding barriers to designing effective solutions. So in the chat, you should find, there it is, perfectly timed. Thank you, Liz. A link to this effective communications cheat sheet that we'll practice using for a number of examples. So you'll see it is breaking up the solutions still into the same 3 categories we've been speaking about. That's information, which is your know, motivation, which is the feel, and action, which is the do. So hopefully everyone can open that link. And I do want you to take a look through it. And as we go, if it's easier for now to just think about know, feel, and do, with every example I give, I'm going to give you a chance to post in the chat if you want a barrier that you see, to sort of test yourself about how you're seeing barriers and solutions that are specifically addressing know, feel, and do barriers. So, okay, this is how we think about, it's the same chart that we use for barriers, but now we're thinking about solutions. So instead of what information is someone missing, we might say, how might we better convey the information that people need to know? How might we better motivate participants? And how might we help participants create a plan so that they actually follow through? So this is a part where I am going to ask you to write in the chat. So start thinking about brainstorming solution ideas to this, what we call, example problem with the high school cafeteria. So we went through the barriers. So in a very quick way, if you work with us, we can spend a lot more time and gather a lot more qualitative and quantitative insights. But we do want you to think about some solution ideas. So how might we maximize the number of students who make healthy choices? So the user-centered perspective you're taking is you're putting yourself in the shoes of a high school student. And while I read these aloud, these prompts, I would welcome you thinking, and I will give you a couple minutes to put ideas in the chat. So for no, how might we help high school students understand what options are healthy? How might we better motivate high school students who think that salads are not cool? And how might we help high schoolers follow through who do want to eat healthy, but are having difficulty kind of ultimately making those decisions in the lunchroom? Any ideas are welcome in the chat, but I also have ideas to share. So I'll just give you a minute. If anyone has an idea or two, that would be great. So I have been talking a lot. Cool Kid shares on social media. Thank you. TikTok videos, I've got that. Flyers, posters of healthy versus unhealthy. Yeah, so that could be sort of like maybe, I mean, I have seen sometimes salad dressing can be very high calorie. I remember seeing that and being surprised. So it's not always what we think. Cool looking sign. Great, these are great ideas. I'll share what I came up with. This is just a fun brainstorm, not something we've tested, and the remaining examples will be more tested. But so sometimes you can think about, you're thinking about students. So maybe like what form should something take? It could be a flyer, it could be like a bookmark as something that maybe they would use or look at in a different way than a flyer. And then I also had sort of emojis or memes or something that they think is funny or cool. I'm not that cool, so I'd have to maybe talk to more high school students. But I also, yes, so you could have sort of emoji labeling in the items prominently, which is kind of aligning with some of what sort of Garrett just wrote in the chat as well about, putting the benefits and drawbacks in big, bold ideas. So it's really salient. And hopefully you're seeing some of this, align with that flyer where we talk about information in particular and making it really the most important information really pop. And so then with feel, you could again have similar ideas as some of you said, let specifically popular students design signature salads or have a contest. And then maybe use things like TikTok, although maybe they're on to the next thing. I'm really not sure. But I think that's still popular. And then do help high schoolers follow through. So the putting the healthier food near the entrance has actually been tested many times. So, if whatever you see when you first walk in and whatever you see when you're already waiting at the checkout line, those are kind of key moments when whatever you put there is probably going to be purchased more. So you could be strategic. You could make you have to ask the person behind the counter for the candy, and that's a barrier. You create friction around the things you don't want, you don't think is in most people's best interest, and then you make it easier to do the things you do think is in their best interest. And you could add a planning punch card, which also gives this idea that we'll talk about sort of foot in the door. If you need 10 stamps and you already have 7, you might be more likely to do those last 3 because you have sort of a goal. So thank you for putting those things in the chat in like a large webinar with strangers. I really appreciate it. All right, so these are, and this is an overview of 4 common types of solutions that we do in behavioral science. So I put process change first because that can be the most effective, but it can take more time to implement. So when you think about that process map that we just did a very high level of, with every step, whether those steps are first you receive information, then you have to sign up for an info session, then you go to an info session, then you get a call, then you do an interview, whatever all the steps are leading to like that front door, you lose some people with every step or even every extra click or link to follow. So minimizing the steps required to complete an action will probably get more people farther along in the process. So wherever you can consolidate steps, less is really more, to get to sort of the meat of what you're trying to do versus just kind of a checklist of steps. Communications are exciting because you can probably try some new things right away. That's why we're really focusing as a very applicable, practical tool is the effective communications checklist. So a common way that we think about communications is either redesigning current communications or adding additional touch points. So those are 2 ways to think about what are our current communications, can they be as effective as possible? And then are there extra touch points like reminders, for example, when people might be missing out on following through? So if you'll notice, for example, pretty commonly we did a reminder for this webinar yesterday, and then we did one an hour before. And that's partially based on research, and we certainly didn't invent it, and I've seen that as sort of a social norm now. A lot of reminders. My dentist gives me reminders all the time, like a year in advance. So they're very on top of these things. And then finally, environmental changes really speaks to that physical environment or virtual, since a lot of things are virtual these days. And that's really going back to that choice architecture piece. So what's the easiest thing to see when you're in a waiting room or a classroom, or what's playing when you're on hold or being transferred, like these sort of found moments, or at the supermarket, again, when you're in the checkout line, you're standing there anyway, what are you looking at? Is there a way to really help people take action, like sign up now instead of take a pamphlet of a lot of information that's hard to sift through? Okay. Now we're going to get into a real example. So this was with Monroe County Cash Assistance, and we do have some people from the New York State Office of Temporary and Disability Assistance here, and they have since scaled this work from the county level to the state level. So very, very excited to have them here. Steph and Savannah, at the very least, those are the ones I could see. So basically, this is the example. So this was a series of randomized tests that I worked at in my 8 years at MDRC. It was a few years ago with the Monroe County Department of Financial Assistance. So the quick background, and this is a very quick version of something that we spent quite a while on, was that, we followed the steps that we talked about. We decided on a perspective. It was the client perspective. We outlined some key steps. We put numbers to those steps. So you are approved that you are eligible for cash assistance. You have to prove that you do some job searching. And these are the people who actually did it. So only 53% of people were actually attending meeting 1, only 31% were attending meeting 2, and then only 21% were attending this unpaid internship. And these were all requirements to be able to keep your TANF or public assistance benefits at the time. And so only once we really had those key areas and we knew who is our target, did we start to really dig into the barriers. And then we designed solutions to target those barriers. And the barriers were the standard information, motivation, and follow-through barriers that we would find in behavioral science. So one communication, this is pretty standard like government communication, a lot of text, small font. And so the general idea is that we did, make it a lot prettier. And one nice thing is, you just say, does it legislatively have to look like the one on the left? Is it mandated that you use that font and that small spacing? And the answer is usually not. So we're gonna go into some of the techniques. And if you see some no field do techniques, I'll just give you a minute. I invite you to write in the chat. No field do solution. So yeah, the color coding, great. That's really about, I'll put the first example, which is hierarchy. So really kind of making something stand out. What's the most important information? It's in a box, it's at the top. And also when you think about when, I would say that the key information for the no barrier is what, when, and where, right? Just simple question words like we learned, in grade school. And yeah, the graphic, the little image, like there's an appointment, it's a calendar. Great, the check mark might indicate that you're already priming people that they should attend. The when box, great. So basically, yeah, this is sort of that idea in that checklist of hierarchy, just really getting the most important stuff in front. If you only read one thing, you should read the details of this appointment. And it should be really clear and easy to know that that's the clear action that is needed, is to attend this appointment. And then we have some field barriers with the why. Why should I do this? Why would I be motivated? And so you want to have some clear costs and benefits. I apologize if I can't tell how big it is or not, but it's probably a little small. But it says individuals like you have benefited from attending this meeting. Discuss your career interests plus options for job training and further education. Explore additional assistance like transportation or childcare. And then it goes into really spelling out the costs and benefits. And we know that people are very averse to losses. So if you talk about sort of leaving money on the table or what's at stake that you could lose, that can inspire more action than talking about what you can gain. So it says, if you do not attend this meeting, you might lose out on some or all of your benefits in particular, in addition to sort of the jobs and the career. And then on the back, we have at the top what's called endowed progress, or sometimes it's actually referred to even in like Harvard Business School as the Domino's pizza tracker effect, which is the idea of the you are here. So a lot of times people feel like a process is really long. It's not clear that they're ever going to reach the end. And so this is an oversimplification, but we agreed with the county that it was worth it for people to feel like they were making progress. And these were kind of in a simple way, the 4 key steps. And then you say you're already on step 3. So then you're also triggering basically loss aversion by saying like you're going to be wasting steps 1, 2, and 3 if you don't continue. And so sometimes that's called foot in the door, but there is evidence that that makes people more likely to complete processes, both because they have the information, they have the transparency about where they are, and also because they have the motivation that you've already put in this work. Don't make that be for naught. And then the clear instructions is sort of how, I would say this is a mix of know and do, probably a little more do. We call them planning prompts or implementation prompts. And then the cool thing, not surprisingly, about check boxes, as we actually have on the checklist, is that people are primed to check boxes, even if you don't ever. So you don't need to you don't need to turn in that paperwork and give them a grade on it. It's just that people are primed to sort of make a plan, to fill in a blank. So just like priming people to get specific about their plans, and this goes directly to that sort of anticipating the potential transportation issues that we talked about at the beginning. So really, we can't unfortunately create a bus, but we can make sure that you're really thinking about a plan and try to prompt you to talk to us if you don't have a way to get to the appointment, because that happens quite a lot in the work I do. Okay. This one is adding new communication channels. I'll also give you a minute here to see if you know any, if you notice any no field do. specifics on this text message. Hopefully a lot of you are using text message reminders already. However, I think at least government clients often are not through a lot of barriers. So states, cities, counties should really be thinking about how they can possibly send text messages, since that is the way that a majority of people prefer to receive information. And also to not be afraid to send a few extra text messages, because if you think about, I don't know if any of you are signed up for like political texting, which is definitely overkill. I feel I get like 1 million texts. However, they have a lot of researchers and they would not send you that many if they thought it was counterproductive. They are sending you that many because overall net, they get a positive benefit from it. So I'm not recommending that you send someone 5 texts a day, but I feel like the nonprofit or government sector kind of overcorrects and is like, well, we don't want to bother people more than once a week or once a month. And that's probably not salient enough in today's society with the average number of text messages you get. Thank you. So you may lose some or all of your benefits is also in there. Thank you, Sam. Any other ideas? Yeah. Hello, Mary, sort of trying to curb like spam ideas, make it more personal. Oh, another thing we did in this actually is that they don't have real like caseworkers in Monroe. So they were concerned about they were concerned about sort of like giving a name that then wouldn't actually be the person that someone works with, but instead they just use sort of the supervisor's name. Her name is Jessica, and then it became a joke when like people called asking to talk to Jessica. That would be like someone's boss's boss. And so they knew that they weren't going to talk to Jessica, but they knew that they'd also read the letter and felt like there was an actual person on the other end of that letter, as opposed to just kind of a faceless government entity. So I thought that was interesting. And thanks with the location and time and encouragement to make a plan. Exactly. So you'll see under the action section, channels, doing multiple modalities, and then timing, we sent 2 text messages. And the last thing we did was for this orientation, we did a process change, and we're coming full circle, literally, to our arrangement of chairs, because what we did change the arrangement of chairs, among other things, to try to make this orientation for an unpaid internship more engaging and meaningful to people. Especially many people had been through this internship before. And so there were there's a lot of prompting and also explicit anticipating. Let's talk about challenges we see in the workforce, right? Childcare, transportation. What are you supposed to do if you need a sick day? How are you supposed to handle kind of issues, interpersonal issues? And then most importantly, prompting people to share their own experiences, because people are really more engaged when they're talking, and also people are more engaged maybe when they're hearing from their peers versus hearing from a teacher who they think maybe can't relate to them. So we actually tracked, and it was almost double the number of people who spoke in a series of over 30 orientations that we tracked. So we had this new version of the orientation that was more participatory. And so we systematically tracked that more people spoke up, there was more participation. And that's one objective way to measure participation. And then also clarifying the benefits and consequences. So again, people like you have found employment, so that's kind of sense of belonging, social norms, and then also sort of really clarifying what's at stake. And we put that annually, because sometimes people don't they think about their benefits weekly or monthly, but and maybe that's not that much, but it can really add up. So really anticipating and planning for barriers, clarifying benefits and consequences. And then this is just to show a little bit of data, since we do have a research background. And I told you at the beginning that, we are covering these examples because we did test them and we do feel that they work. They are not gonna, change things by 50%. So that's sort of the bad news. The good news is that they're basically free. We actually did calculate the basically redesigning and adding a letter and then adding some text messages. And it was $1.69 per client. And that was, very affordable. So sometimes if you want to do the quicker wins, it's going to be, you know, 5 percentage points, but actually a higher percentage. So basically they did make an impact, and they seem to pretty consistently make an impact. Okay, so we're going to do one more poll to make sure people are still awake. Thank you so much. So if you are buying jam in a supermarket and one display has 24 jam options and one has 6, which display, and they did really test this several times, which display would lead to more people buying jam? Very interesting results here. Just give it one more minute. Still coming in. Okay, last chance. All right. Ending the poll, sharing the results. So amazing. We had universal agreement that less is more. I feel like so proud of my students today. That is the correct answer. Does anyone want to put in the chat why they think 6 was better than 24? Yeah, reduces decision, say choice overload, too many choices can be overwhelming, easier to process and see choices. Exactly. So one thing that is interesting is, I will say that the more jam, the 24, the wider variety of flavors did attract more customers. So more people kind of wanted to look and see the novelty of, like, what are all these flavors? But then there were a lot more purchases made when there was less decision fatigue. And that can be really hard, because sometimes it is a really hard balance. We want people to know that they might have a lot of options, but you just need to kind of bite size or right size those options so that people can make informed decisions. I mean, there's also, you know, tools you could do of, like, do you prefer this or this? And then, you know, compare things sort of one-to-one. Just different ways you could think about helping people make decisions and overcome that overwhelm. So this is a very exciting use of the chat. Thank you so much. Makes me feel like people are here with me. Okay, so we just have like 2 more examples. So hopefully, if you haven't already seen these a lot in your daily life, I'm sorry, you will see them everywhere and you can't turn it off. So you might take screenshots and send your friends, like I do, because that's the kind of friend I am. But this is from Expedia, and this really was my flight, right? So it's very clear what they want me to do. I would say this is pretty heavy-handed, but if Expedia can do it and they're just trying to get me to give them money for something that's unlikely I'll need, you know, a lot of you are really trying to help people do things that they really could benefit from. So you can be a little more heavy-handed about, you know, just how you offer things. Ultimately, people do have choice. So, you know, you have to make it in general, not including like mandatory programs or K-12 schooling, but many of the partners I work with, you know, people do have choice, but you do want to make it as easy as possible for them to focus on the content and not all the red tape, process, administration. So yeah, this is just pretty classic 3 reasons you might need travel protection. So kind of helping with that motivation, that feel, giving you specifics. That's kind of, you know, a variety of things. Then they're trying to make it, it's like it is active choice, because you have to pick yes or no if you remember that diagram, forced choice or active choice, but they're trying to get it closer to an opt-out by sort of pre-selecting green, the yes. I have seen in the past where they pre-checked the green and then you would have to uncheck it. That would be an opt-out or a default. So yes, I want cancellation protection. 65,000 people did it. Don't miss out, you know. And then no, I'm willing to risk. So really explaining the benefits. I'm willing to risk my $226 trip. And then I don't even understand how Mary got $468 back if she only spent $226. So you need to make sure that the numbers are correct. But these, some of these private companies are really kind of using everything they can to get you to buy more. But some of the techniques that they're using do have evidence. Okay, and this is my last slide before our final reflection. So I think with the jam, there was a really good indication. I can't believe it was 100% in a blind, like you couldn't see what other people were putting. So very cool. Just this is an example of, how much you kind of see that first thing that's bolded. And then, a lot of people just put a lot of time into all 4 lines and don't put enough time in that first line. So if there's one thing you take away, I would definitely say, make it crystal clear when you see something, what is the action you want me to take? Or what should I do in response to this communication, if anything? And how can I do it easily? So the what is the information and the how is the follow through. Okay, so for our final reflection, we'll just review what we've covered, and we'll put in the chat both the effective communications checklist again, if you didn't get that earlier, and we'll send it around as well. And then a bonus tool, which is called Simpler, which goes into more specific techniques that I've referenced, such as social influence is the S in Simpler, I is an implementation or planning prompt, M is making deadlines, P is personalizing, L is loss aversion, E is just general ease, and R is reminders. So those are kind of another layer when you're thinking about solutions to sort of check yourself on. And all this is just an indication that there is a lot more we could cover, but I think we made it through a lot in, under an hour. And I would try these techniques on yourself with the no feel do, with this what can you commit to. So if you do have a pen or you're taking notes, I would really encourage you to try to think about 2 concrete ways you can apply what you've learned today. And again, those of you who are staying for the peer sessions, we can talk about these things. So try to write down 2 things that you can do. And then what are your next steps this week? And so you want to give a time point, and then how will you hold yourself accountable? Do you put a calendar reminder? Do you tell a colleague? Do you set a meeting with someone to talk about it? Whether that's next week or at the beginning of 2026, just trying to, those are all like mini behavioral interventions. Okay, and I have not been able to see what's happening with the Q&A, but we do invite you to continue to post your questions, and if we can't answer them now or in the peer session, then we will be sending around some more information. I'll turn it over to Sam.
Thank you so much, Rebecca. That was fabulous. Every time I hear this material, I feel like I learned something new, and I hope all of you did too. So what's next for you? We encourage you, like she said, to use the effective communications checklist and the simpler solutions. We welcome you to stay and talk with your peers. And if you have more questions, please reach out to us at our email address, e2p@mdrc.org, or if you want to share more of what you might need. Those of you who have a busy day and need to get back to things, we say goodbye, and we'll welcome you back next year for further webinar offerings. For the rest of you, we have 4 different rooms, that we try to do our best guess at identifying where folks are coming from. So we have a breakout room for education. We have a breakout room, and I'll be in that room. We have a breakout room for workforce and employment. That will be with Rebecca. If you do work with family programs and children's services. Oh, excuse me. Workforce is Donna. My apologies. Donna Orton Fields is joining us. Families and children is Rebecca. And then general interest, if we didn't hit on the right topic for you, John Martinez will be in that room. So come and join us for some chatting.